Hello, everybody. My name is Nigel Pitts, and I have the privilege to be the Global Chair of the Alliance for a Cavity-Free Future. Welcome to this, our first Global Virtual Summit. I'm going to start just by introducing what Alliance for Cavity-Free Future is, because some of you might not know. So we talk about ACFF, Alliance for Cavity-Free Future. Who are we? We're a global not-for-profit organization formed in 2010, and we are seeking to promote integrated clinical and public health action to confront the disease burden of dental caries or dental cavities or tooth decay, however you know it locally where you are. Since 2013, the ACFF Global team has worked out of King's College London and the Faculty of Dentistry, Oral and Craniofacial Sciences. And the Alliance is composed of the global team and 29 different chapters spread globally. And here on the slide, you can see on the left, the launch of the ACFF chapter in Malaysia some years ago. On the right, we have Nigeria. And in the middle, we have our global expert panel. We're lucky enough to have got a team of experts from around the world that meets annually to make sure that we are on track, doing what we're doing, meeting our goals, and reflecting on the best way to move forward. So these are the goals. There are 4 goals, the global goals, which all chapters try to advance, but sometimes different chapters have their own additional goals. So the first one, our so-called stretch goal, every child born in 2026 and thereafter should stay cavity-free during their lifetime. Now, that's a challenging goal, but the evidence says if we all work together, it is achievable. The other goals are broader. So goal 2 says that we, the Alliance and our chapters, will work towards ensuring that 90% of dental schools and dental associations accept a philosophy of what's been called a new approach to looking at caries as a continuum. But we have to be a bit careful calling it new, because in places like our Nordic chapter, it's not so new. In other places, it is new. But we want to improve caries prevention and management using up-to-date evidence, up-to-date science, and up-to-date care philosophies. So goal 3 is that the Alliance and the chapters will work collaboratively with a broad range of organizations to achieve a reduction in caries inequality. We know that the inequality in caries is stark, and that's a reduction both within and across countries and in the broader context of both oral and general health. And then lastly, ACFF and its chapters, members and partners will work to promote integrated, comprehensive and locally appropriate caries prevention and management systems, and also monitoring, because one of our big challenges is it's hard to monitor where we are with caries when we're not collecting good surveillance data. So that's the scope of what we do. And here's a map of the 29 chapters working in more than 40 countries, starting in Colombia in May 2011 and working around the globe till we get to October 2021, when we're delighted that we're just kicking off a UK chapter. So this is the global footprint of the Alliance for Cavity-Free Future. Now, there are 5 areas of current global focus. Partnerships are really important to us, and we work hard to expand and improve those partnerships. The excellent liaison with the International Association of Pediatric Dentistry is a great example of that. Driving policy development, you're going to hear quite a lot about at this Global Virtual Summit, and the 3 policy labs we've held in conjunction with the Policy Institute at King's College London have been really very successful in helping drive forward policy development in the caries space. Obviously, we support local chapters, and we try and do that in as many imaginative ways as possible. And the photograph is pre-COVID, when I could actually travel and visit chapters. And that's an example from Poland, when we joined together with pediatric dentists and others across Poland to push forward a new initiative. Aligning on best practice is really important, and you see on the right the 4D system of Caries Care International, and that system, which you'll hear more about in the virtual conference and in the lectures, is really making good progress in bringing together best practice and a global consensus of how to do it in the real world. And then lastly, we have an image of the Win6 stakeholder cube. We want and need to build an effective, collaborative, multi-stakeholder network around this shared ambition of moving towards a cavity-free future. So why a virtual summit? That may seem obvious, but let me take you through the logic and the history of what's happened. The concept came from a realization that we couldn't mount what used to be our conventional annual ACF summit at the World Dental Federation FDI meeting in Shanghai 2020, thanks to the pandemic. And we wanted to reclaim this lost platform and create an event that would be accessible to a broader community of all ACFF members around the world, all chapters and supporters. And we have set this up with 3 parallel strands of activity, which we very much hope will be of use to you and appealing to a broad community across the world. The first is the virtual conference. The second is an ACFF chapter network. And the third is specific activities driving policy development. And I'll take you through a little bit more detail of these 3 themes. So the virtual conference seeks to educate, communicate, and animate. And we've put together a carefully constructed program of high-level relevant talks, all free to access. And we've hoped that this conference will be successful in giving you a lasting educational benefit. It'll offer updates on the state of play in the caries space across dentistry and dental public health. And we hope we can successfully share and communicate to you areas in which change can be made and which we can extend the influence of ACFF in moving towards our goals. And we want to animate attendees to join the fight for a prevention-based, cavity-free future. So that's the virtual conference. The chapter network is to try and create, through the digital space, new opportunities for our chapters to showcase the wonderful work that's being undertaken in their countries, but often isn't visible outside of their countries. And we want to inspire chapters to build better connections and share best practices between them. And today, that's Tuesday, the 12th of October at 13:30 BST, we'll have a chance to celebrate the breadth of the work undertaken in the chapters with our live ACFF chapter showcase session. Thursday, the 14th, our morning program from 900 BST will consist of local updates and case studies from many of the chapters. So we hope that this network can facilitate communication between the chapters. And then lastly, driving policy development. We want to continue and accelerate the movement towards a focus on prevention within dental policy, and this really is core to our mission and making things happen. And this year we'll be offering summit participants an overview of what the future plans and focuses are for the newly formed ACFF Dental Policy Lab network. That kicked off a few weeks ago in September, and a session will take place today at 14:30 BST. That's Tuesday, the 12th of October, and that'll be presented by Professor George Takos from University College London, who's been part of the core group steering this exciting new Dental Policy Lab network. So the program, 3 days of presentations from a variety of world-leading speakers, a mixture of pre-recorded lectures, but also interactive live events. And after their program time, because we're very aware of the time differences challenge around the world, the lectures and the sessions will be available on the Summit platform on demand throughout the 3 days. And all sessions will ultimately be available to ACFF members via the ACFF website after the Summit is complete. The full program can be found on the ACFF website and you see the address at the bottom of the screen. So you've got detailed programs for each of the 3 days. There's a live forum. This is on Wednesday the 13th, Caries After COVID, Reflections, Plans and Ambitions. And it's a mix of some recorded presentations and a live panel discussion being held from London. The presentations will include Marko Vujic, the Chief Economist and Vice President of the Health Policy Institute at the American Dental Association. He's looking at the impact of COVID-19 on dentistry in the US. The current global policy situation, Dr. James Taylor will give an overview of all the exciting things that are happening in really what's been a very busy year for global dental policy. And James is Secretary of the FDI section of Chief Dental Officers and Dental Public Health. And then I'll be giving an overview from ACFF about what a cavity-free future in the caries space might look like. So that's a live forum session coming as part of this meeting. I also want to just make clear that over the last few years, we've been able to bring together a number of global activities into one global collaboratory for caries management. This is another acronym. We apologize for the acronyms there are in international caries work, but the GCCM, the Global Collaboratory for Caries Management, facilitated by King's College London, brings together a lot of partners working in a collaborative way in a virtual laboratory or collaboratory, if you like, working to address prevention and management of caries across the life course. And you see in this umbrella, caries starting literally before birth, early childhood, through development, through adulthood, to older ages, and looking after the vulnerable and the older and the aging and super aging societies. So under that umbrella, on the right-hand side, we have ACFF. As I've said, we've been in existence as a UK-based charity. We were founded in 2010. But on the left, we're also working hand in glove with another charity, the ICDAS Foundation. And ICDAS has spawned the ICCMS, the International Caries Classification and Management System. And there's been a lot of research, a lot of literature, a lot of great steps forward through that initiative. And then more recently, Caries Care International has been formed under that same grouping to take the evidence and the science into routine practice, because it's so important that we influence what happens day to day. So controlling tooth decay across the life course, that's what this umbrella group does, and it's facilitating the delivery of what the FDI calls preventive dental medicine, which I think is a very useful term. So in bringing this introduction to a close, I really want to major on the acknowledgements. We couldn't have this global virtual summit without the assistance of so many different people around the world, all of whom have contributed in many ways, giving up their time on this long, complex ACFF journey. And the journey is accelerating. We've got a lot to do yet. But I'd like to acknowledge all of the ACFF staff, the volunteers, the chapter team members worldwide, all at the Faculty of Dentistry, Oral and Craniofacial Sciences at King's College London, the ICDAS Foundation Board and the ICDAS Coordinating Committee, those who've helped with ICCMS and the broader group, the Consensus for Caries Care International, those who've partnered with us from other organizations around the world, the Colgate-Palmolive Company for their generous support to the ACFF charity since 2013, and all who have supported our work on caries and a cavity-free future, whether that's financially, intellectually, or emotionally. So that's the introduction. Thank you and enjoy the 2021 ACFF Global Virtual Summit. Goodbye.